So what we're doing is when I suction this fat, what we're doing is, if you think about it, fat is like in a cobweb, like outside, and the cobweb has all these little spaces. And what happens is the fat is like sitting in those spaces. So when we remove that fat, what happens is the cobweb will contract, and that's why over these next 1, 2, 3 months after the liposuction procedure, you'll continually see contraction of the skin. So that's really nice. You know, if you, like I said, if you were 80 years old, you're not going to get as good a result. But because you're so young, you're going to get, you'll get a lot of contraction down there. You were wondering why I did all these lines and markings and everything, and why I do one circle here and maybe an outside circle there. It's kind of like a topographical map. The area where I put another circle is where there's a little more collection of fat. And I have you do that when you're standing up, and that works great. But when you're laying down, it looks different. Your body moves differently. So what I need to do is, I'll know that where I put an extra circle or some other extra circles, that there's a little more collection there, and I need to focus a little more in that area. So that's why you'll see all the different marks and things like that. Another important thing is where I put the holes. I like to put them so you can't see them, and that would be key, because you don't want to walk around with all the marks all over the place. So a lot of times I'll hide those holes in those particular areas that are less noticeable, like in your instance underneath the arm here, at the point of the elbow. Now they'll allow things to drain nicely, but they won't be able to be seen as easily.